to make that.
Yeah, exactly.
No,
and that's the whole idea, because
yeah.
if I told you now, come, let's talk about blood, you wouldn't come. But if I come for a beach party,
it means it will come.
You will come.
Yes. Yeah.
Yes. So there is a blood. There's going to be a blood donation event there as well. But then what I want people to realize is that it's not just about the blood donation. It's just awareness. So if you can't donate blood, don't be scared. Just come and see how you can support. You might decide that because of that you're going to organize one, or encourage other people to do it, or volunteer, or like what you're doing right now, Hits FM, just setting the agenda and telling people about it.
Yeah.
But one other interesting thing we're going to do this time is what we call the green giving. Green giving, where we're giving fruit seedlings to donors. So in addition to what we give them normally, we have about 12 different seedlings. Anything from cashew to pawpaw to cocoa, aluguntui, sweet apple, yoyi.
Yeah.
I mean, name it. I don't know what fruit you like, but I'm sure we have it.
Hey, you said aluguntui and yoyi.
Okay,
I'm coming.
Yes.
Yes.
Yeah, I mean, most of the fruit, oranges, everything.
wow.
So the donor gets to choose, and the whole idea is kind of doubling the impact, because, so that's why you have the slogan, give life, plant hope during the giving cycle.
That sounds interesting.
Yes. So you're helping people live, you're giving them hope, and then at the same time planting, what all that does with, Green Ghana and what trees do for us. And then as the tree grows, it bears fruits. I mean, you're doubling or tripling.
So this is a 2 for 2, giving back to society.
Yes.
You're giving blood, and then you're actually planting trees, which we need. It's become a thing that we need to do now. That's a wonderful cause.
Thank you.
I'm excited about it for you, but I need to ask you a few questions. If I was deferred once before, am I still eligible to, donate blood?
Yes. So if you were deferred, then it meant that maybe you were deferred based on a particular reason. Maybe it could be that on that day you had taken medications, or maybe you had a low blood volume. Maybe that day you had some high blood pressure or low blood pressure, which made the medical personnel on ground defer you maybe for 2 weeks or for a month or two. So for this particular March-to-March blood donation, we are inviting everyone to try as much as possible to be present. We'll have a medical team available on site to screen you and reassess you to see whether you can donate or you cannot donate. It's also important for me to also highlight that for everyone coming, we are expecting come for the March-to-March donation.
Yeah.
But if you are coming for the blood donation, be mindful that we'll be taking blood from people aged 17 years and above.
Okay.
And also the upper limit will be 60 years. So we'll be taking blood from that age category.
Okay.
As for the in-between requirements, when you join us, we'll go through the process and we'll determine whether you can donate or not.
Wonderful.
So do not be anxious to everyone coming. We have expert professionals on site, to take very good care of you. Yeah, thank you.
And talking of what he's saying, take very good care of you. Much as they need the blood, they are very professional about it. So they're not just going to take your blood just because they need it. Your life is much more important than the person they are trying to save. And so they're going to ask you the relevant questions, make sure that you are healthy, eligible to donate before.
That sounds like a good idea, but let me ask this. Every year we come out, stations open up their platforms, give to people to talk about donating blood and stuff like that. And I'm part of everybody who says that, Charlie, isn't the blood bank full already? So why again are you asking me to donate blood and stuff like that? Why are we always asking people to donate blood? Because I think there should be enough to serve people in the hospital. And I will say
the need is constant, and I'm sure Cyril will add to it. The need is constant, unfortunately, and we have more people needing the blood than those are given to us. In every country, it's about 1% of the population that needs to give. In Ghana, we're about 30 million, so about 300,000 people.
Wow.
Now, if you think about it, there's sometimes some surgeries, whatever, need or require more than 1 unit of blood, maybe 12 units of blood. You go for a whole blood drive, you get 25. It means that what you got wasn't enough for just one person. The other thing is that, blood is, you can't have blood forever. So every 35 days or so, it sort of quote unquote expires. But usually we don't have enough to even get to that level. And the other thing too, there are different blood groups as well. So there might be the blood, as you can see, but then maybe a blood group is not available. So it's also important that we have all the different blood groups there, but we just don't have enough. That's a real issue.
I see.
Yes. I mean, sometimes Kolebu Teaching Hospital alone needs about 200 units of blood in a day. Yes, and I know sometimes. Yes, sometimes.
Come back.
Sometimes Kolebu Teaching Hospital alone needs about 200 units of blood in a day.
200.
Yes, because when you think about all the needs for blood, cancer patients, babies, accident victims, leukemia patients.
The cardiovascular department, yes.
Yes, all these people need blood. So it's like, and sometimes somebody was asking me the other day, for instance, COVID, how were we surviving? Sometimes you have to prioritize one surgery over the other because you don't have enough blood. So there's a C-section, the mom needs to have the baby right now, so she's probably going to get blood. Somebody's can probably wait maybe a week or two, and that's how they were juggling it. But for you, your life is important. So there's not like priority is you understand? Yeah. But if it's not there, it's just not there, and there's no substitute.
Wow, 200 units a day.
About that.
Yeah, to even put it in perspective, if you do the numbers, it means that we'll be needing about 850 blood of unit for Ghana every day. That's across Ghana. We need about 850 donors daily to be able to meet our demands of about 300,000 blood units yearly. So, just like she said, because of the expiry date attached to the blood and also the demands that comes with it, road traffic accident, dialysis patient, you are talking about women who unfortunately bleed during labor, postpartum hemorrhage, even babies also who need maybe some blood component. So the need is huge, but the supply it's very, very low. Yeah. So that is why we are always asking organizations such as Kwaba Foundation, faith-based cases group, and also faith-based organization to join blood bank service, to solicit for more blood from.
I see.
And just to add a little bit to what Cyril said, we should have enough blood so that by the time the patient comes there, the blood is waiting for the patient and the patient waiting for the blood.
Okay.
Because obviously if the blood is there, the chances of the patient surviving is much higher. And that's why we always have to make sure that we have enough blood. Sometimes we can't even have enough for the emergencies or the cases at hand. Much more think about storing some for later.
I see.
Yeah.
Wow, I didn't even look at it from that angle. I don't think most of us haven't even looked at it from that perspective. Wow, that's a lot. That's a lot that we need. And wow, some people have a fear. Even for me, for instance, I'm like, I always have that issue of being anemic and stuff like that. And I know a few people also have to deal with it. And some people are just plain scared that if I donate blood, it's going to deplete mine. I mean, it won't be enough for me. You get me? Yeah. Is that a misconception or
Yeah. Yeah, so I think that's also another huge misconception on the street. So one thing I always tell donors is that you actually have enough than you think of. So, for example, for every human around, you have about 10 pints of blood available. And the blood donation is taking just 1 pint of blood. And even with the 1 pint, which is about 500 mils, we are taking around 450 mils. Okay, so your body, God is also wonderful in its way that the body is able to re-engineer itself. That after donating, after 24 hours, your blood volumes comes back to the previous state.
It does.
Yes, it does that. And also with the red cells, it takes some few weeks, then you have up to the optimum requirement. So you don't need to be afraid. You have more than you think you need. Let me put it this way. It's just like you having a reserve tank. Okay, you have the main tank and the reserve tank. So we'll just be, let's say, tapping from the reserve tank. Then the body re-engineer itself to fill it up. Then trust me, you'll be okay. But another thing we do is that our colleagues, professionals also will take you on what to do and what not to do.
Okay.
Because mostly after donating, you are not expected to do some rigorous activity.
Okay.
Because the body is going through that phase to restore itself. Yes.
And just to add to what Cyril said, so after taking the reserve and you're getting a new one, it rejuvenates your system.
Exactly.
So like you're saying, a lot of people are thinking about, it's depleting, my blood and all that. Like they're thinking about negative. But as a matter of fact, there's more to gain as a donor than as a patient. Because like you mentioned, rejuvenates your system. You get to know your blood group.
Yes.
Some diseases like heart diseases, cancer and stuff is kind of reduced. You live a healthy lifestyle because all the questions they're asking you too, it's like, free health check.
Oh,
so
wow.
when you go do a check, you have to pay for that. So there are so many benefits that you gain by donating the blood yourself.
Okay.
Yeah.
Okay. So real quick, if you're not eligible to donate, what can you do?
Yeah, so I think for the March to March, we are calling on everyone to join us. You can be engaged in volunteering roles, just like Hit FM. You can also give us platform for us to promote blood donation drives. And also, we are also calling on other organizations to support the blood banks to also be able to meet our blood supply.
And sometimes it also depends on why you're not eligible, because there's so many reasons why you may not be eligible. Sometimes the reasons are just as basic as you haven't eaten properly.
Oh.
So what do? You go eat.
Something properly,
yes,
yes,
exactly. Your blood level is low. What do? You find, some of these raw cocoa drinks to drink, or abedru or whatever, Others might be that you are on medication. That's why you can't donate blood. So once you get off the medication, you can't. It could be you're pregnant, you're breastfeeding mother. I mean, those are things that it's not like a lifestyle forever.
Yeah.
So it really depends on what the reason is, because usually if you're deferred, you can always come back to donate based on what the reason is, and once you get that corrected.
I'm really grateful for your time. Thank you for coming to explain and giving us some in-depth knowledge about, blood donation and the reasons why we need to, do that. We never know who's going to be. It's going to be your family member. It's going to be someone that you adore, you love, and then we all need to do our part to do this. But ladies and gentlemen, if you're doing the listening, this is happening on the 2nd of March. It's the March to March blood donations, the 7th anniversary. And then we're walking from La Boma Beach through the La Township and back to La Boma Beach. It's the walk to create blood donation awareness. And then we're going to be donating blood too. Trust me, it's going to be a beach party, but we're donating blood.
And you can wear white or red t-shirt.
Yeah, right. White or red t-shirt to symbolize what we're doing. It's starting at 5:30 a.m. till your mother says it's okay, come back home. And we're going to have a good time. So dress sporty, red or white t-shirt on some nice jeans or shorts or something. Come and let's have a good time at the beach. It's happening at La Boma Beach. I'm very grateful to Captain
And
Yoma.
all ages
from 17 to 60.
No, that's for the
donation.
But
yes.
for the event, even
Just
90,
come and let's have
90 years, 2 years, everybody's
Is
invited.
there
The whole
aerobics for
family.
me?
Yes, aerobics. We'll be expecting you.
And we'll come and dance. We'll do dance competition. Thank you so much, Mami.
Oh, we do that there too.
Hey.
And thanks to our sponsors. There's so much to give out. Thanks to our numerous sponsors. So please come, and thank you, sponsors, for making this happen.
And this is a worthy cause, so I think we should all come through. Thank you so much for your time. Thank you so much for the explanation. It makes a lot of sense, and now we know what we're doing, and we need to give back to society. Thank you, Captain Yoma. Thank you, Mami Kuba. I love your name. Thank you so much. We're just talking to the K-Sense Foundation.